felt good for us to be able to feel like, hey, we're an innovative practice. We're always researching and kind of bird dogging the latest technology to bring to our patients, to bring to our community so that we can just take better care of them. My name is Dr. Larry Golson, and the name of my practice is Envision Eyecare. I started the practice Envision Eyecare in Asheville, North Carolina in 2008. We've been able to grow year after year. We've decided to make sure that the patient experience is at a top-notch level. That type of approach to care has been well received by our community. And through that innovation means staying up to date on the latest technology and trends in the field. And this is why I'm really excited about our new Optopol device. The idea was first put up that we might have an opportunity to change and update our Humphreys visual field. At first, a few thoughts went through my mind. One was, well, Humphreys is like, quote, standard of care in the industry. Ideas about, will this be reimbursed by insurance? Will it be something that we can use to compare the new device to the old trials of the Humphreys visual field? Will my team adopt it and feel good about it? Because sometimes in this field of optometry, we don't like change. And so the unknown versus the known can be something of a stumbling block for adding new technology to a practice. And at the same time, I recognize that our Humphreys visual field is like a mini skyscraper. It's a big device. It might be a little intimidating to our patients. And when they have to put their head in this large instrument, they come to dislike that test a lot. And I think that's across the field. When the new instrument from Optopol was first brought in, I still think that there was a level of excitement on the one side. And on the other side, there was a level of fear of, what is this actually going to do? Is it going to be something that we can really use and still take great care of our patients? What we found out very quickly was that we actually were able to use the visual field analyzer very seamlessly, moving from the old to the new. And we actually were able to take the new printout and compare it to the old printout. We don't actually print them out. We use them on our computer screen, which was also a very cool advantage of this, was that we were able to upload it into our electronic medical record charts. And before, it was a lot more clunky with the Humphreys unit. The other important piece is that we can actually compare the old trials from the Humphreys to the new trials. And if I'm looking at a glaucoma patient or a macular degeneration patient, I can draw a conclusion to say, is this progressing or is it stable? And that was one of the big fears from me and Dr. Bryant was, are we going to be able to have, continuing care for our patients? And the fact is that's exactly what we find, that we can continue the care seamlessly between the two devices. If I were speaking to another optometrist about the idea of updating their visual field, and I'll date myself that I've been practicing optometry for 20 years and in school for 4 years before that, knowing that I've used the same device for that long, there's a level of comfort in that. Part of me did feel a little excited I could bring something new to the practice that felt better for the patient because it's newer technology. There's been years of updates, computer processing that has improved in 20 years. It felt really good to know that we were going to bring this into our practice. And as an optometrist, I think it's really important to think about our patients' perceptions. And when they have come to our practice for 10 years, 15 years and see the same device year after year after year, what would it be like to climb inside their head when they walk into the room and see a new, sleeker device, smaller footprint with a cool blue light around it, which I think is just a nice design feature to be able to tell that patient at that moment in time, hey, we're making sure that we're up to date for you. That is what I think is one of the most compelling items to the idea of taking something that's been established and bringing it into the 2020 year and decade. As with any new piece of equipment, one of the concerns is how quickly are we going to be able to use this? Is it going to make us stumble? Is it going to delay patient care so that we're running late every time we use it? And what was really cool to recognize when we began using this device is that it didn't slow us down at all. Sure, the first day we actually practiced, and I would advise any optometrist bringing in a new piece of equipment to spend some time practicing with the team members and doing it on each other to get acclimated to it. We did that. And so when we started using this device day one, it was seamless and we actually did not run behind. The only part of it that we had to learn as a doctor was where to pull it up in the patient's chart, because that was new for us because we had a clunkier system with the Humphreys visual field analyzer. Having years of visual fields from another unit, another device, I know that one concern that we had was, will we be able to pull up the old test, or would we have to search through a whole big database to find a patient The folks over at Optopol were able to put our old visual fields on a thumb drive, and we plugged that into our new computer on the new device, everything downloaded. And so now we have all the data in one place. And for us as doctors trying to analyze data over years, it felt really good to be able to know that we had the old tests that we can compare to the new test. It was very easy to actually switch from one unit to the new unit. I do feel like it's more efficient for our practice and we still get great data. And one thing I know that as I'm working with patients real time is I don't want to lose the quality of data just to improve efficiency. But if I can improve efficiency and still get quality information, then I'm all for it because we all know that time is money. And so one of the pushbacks we get from our patients, oh, I got to take that visual field again. They don't like the visual field. And so if we can tell them, hey, we have a new device, it's newer technology, it takes less time, it's easier to perform, then they kind of brighten up a little bit. And it's almost like a weight is lifted off their shoulders so that they now know that it's not going to be the same old long visual field test. It feels like we've had it for a long time now, even though we've only had it for a couple of months.